So over the last number of years, there have been significant changes in aging and the perception to aging. The recognition that decline and dependency is not inevitable, and that there are very positive things that we can do to maintain independence and autonomy. That's been the most exciting development in my view over the years. Society and the medical system has responded to the crisis, or the potential crisis. And the good news is we've seemed to have starting to get our act together with respect to making the necessary changes. There's much more to be done, but clearly the first step is the recognition that there is a problem. The second step is to understand what the problem is, and I think we have those two steps have been well established. And the answers, at least in some areas, seem to be forthcoming, so I'm very optimistic for the future. So one of the big changes, which I think is really key, is personal-centered care. The recognition that doing to people is not nearly as effective and generates far more problems than allow people to do for themselves. And recognizing that allowing people and encouraging people and facilitating the ability to remain independent is probably the most important development in the field of geriatrics and gerontology over the last number of years. The recognition that institutionalization is a profoundly negative experience in many cases, and the strategies to reduce the impact of institutionalization. The simple step of, for example, introducing a salad bar, a self-service salad bar in some nursing homes has been enormously positive, improving the residents' perceived quality of life. Plus, interestingly, a decreased narcotic use and laxative use. A happy facility makes a staff that enjoys coming to work. So people enjoy working in a positive, upbeat environment. So you can always tell when you visit a facility, is this a dynamic place where people enjoy coming to work, or is it the same old, same old? And I think the recognition of how you can make that difference is very important. People coming to acute care obviously have an acute problem which needs to be addressed. But before they can go home, they need to at least begin the period of rehabilitation. And unless we apply these principles in acute care as well as complex care, we will just be shifting the problems earlier on in the healthcare delivery system. So the same principles definitely apply in acute care as well. Well, I try to walk the walk, talk the talk enough, try to walk the walk. The biggest challenge I have is curbing my own enthusiasm, I guess, and trying to recognize when sometimes discretion is the better part of valor.